Hello everyone. In this webinar we'll be talking about return to play after shoulder injuries. It's important to know that this is a general, common sense info on the topic. You'll be provided with many examples so you can pick your solution based on the specific case you're dealing with. So remember, always check with your doctor or physical therapist first what kind of injury you have and what caused the specific injury. Let's start with revealing what we are going to talk about. We will briefly talk about shoulder joint. Then we will reveal three most common shoulder injuries. After that, we will start with a practical part, the most useful types of shoulder healing movements. And we will finish with a brief programming strategies. And of course, summing up. Let's begin with a brief introduction. The shoulder joint or glenohumeral joint is a ball and socket joint between the scapula and the humerus, as you can see here. It's the major joint connecting the upper limb to the trunk, and it's the most mobile joint in the human body at the cost of joint stability. Shoulder joint is probably the most complex joint in the human body because of those surrounding structures, joints, ligaments, tendons, and other soft tissue. This joint is the most mobile joint, but at the same time it needs an optimal stability in order to stay healthy and on top of performance. The three most common shoulder injuries. Number one, slap tear. This is a tear to the ring of cartilage, labrum, that surrounds your shoulder socket. It tends to develop over time from repetitive overhead motions, such as throwing a baseball, playing tennis or volleyball, or swimming. Estimated return to sport time frame is 6 to 12 months. So when those passive and active stabilizers are relatively weak, especially an eccentric strength of biceps in specific throwing positions, plus rotator cuff muscles don't do great work of centering ball in the socket all the time. And on time, we have increased chances of this kind of injury over time. Shoulder ball usually moves forward in a socket and put a biceps tendon along with cartilage under higher tension. Or this kind of injury could happen after contact with opponents or with a ground or similar. Number two, shoulder instability and dislocation. Shoulder instability happens when your ligaments, muscles, and tendons no longer secure your shoulder joint. Return to sport time frame 2 to 6 weeks and often longer. As you can see here, we have a picture of normal anatomy over here. Anterior dislocation over here and posterior dislocation. This usually happens after forceful contact injuries, whether with ground or opponents. Anterior dislocation is more often because muscles that stabilize shoulder joint from the back are usually weaker. But when it comes to non-contact injuries, loose joint can pinch surrounding structures at least, which can cause various issues. Number three, rotator cuff injury. We can see a couple of pictures here. Usually seen in athletes participating in repetitive overhead sports, baseball, volleyball, handball, tennis, water polo, swimming, etc. This kind of injury is typically characterized by weakness in the shoulder, reduced range of motion, pain, and stiffness. Return to sport time frame, shoulder impingement, usually 3 to 6 months, rotator cuff tear, 4 to 12 months. In the top picture over here, we can see inflamed tendons that can become torn if pressure on them is high and long enough. Down we can see shoulder impingement syndrome. It happens when there is impingement of tendons or bursa in the shoulder from bones of the shoulder. This syndrome involves inflammation of tendons of the rotator cuff muscles, usually supraspinatus tendon, and sometimes the long head of the biceps tendon. Shoulder impingement usually happens when moving an arm overhead while having poor scapular upward rotation. A very important thing we all need to remember here is that return to sport depends on many factors. It's always individual. Recommendations and how fast one will return to sport vary and differ depending on age, gender, type of sport, general shoulder fitness prior to injury, position of the athlete, time in the sport season, associated pathology, history of injuries, rehab quality, genetics, etc. Before being allowed to return to sport, athletes should be pain-free, demonstrate good shoulder strength, and functional range of motion that allows sport-specific participation. Athletes will feel when is the right time. We need to mention a very important thing here. Almost all the shoulder issues occur when surrounded active and passive structures are not synchronized, at least. First and foremost, rotator cuff muscles need to work together in order to keep humeral ball centralized in the socket. No matter what position of your arm is in. All the big muscles around shoulder joint need to be strong and flexible enough in order to keep the joint and smaller stabilizers safe during very demanding moves. Also, the scapular upward rotators need to be strong and synchronized with the shoulder joint, especially when moving overhead. And we need to avoid the kyphotic posture as well as forward head posture. So, now we will start talking about how to properly select useful exercises in order to make this possible, which is at the same time very useful for choosing the right return to play strategy. The most useful types of shoulder healing movements. There are 4 basic movement patterns for arms: horizontal push, horizontal pull, vertical push, and vertical pull. Number 2, functional range conditioning. We'll be talking about this very interesting philosophy a little bit later. Number 3, basic dynamic flexibility. Number 4, external and internal rotation. And number 5, perturbation stability. Now let's start explaining each one. Horizontal push works on pectoralis muscle, serratus anterior, front delts, triceps, etc. It's better to do open chain moves in order to include stability demands. Okay, over here the first exercise I will show is a typical horizontal press, cable press exercise, single arm. It's a very important basic exercise to strengthen front shoulder structures and shoulder in general. I mean, during this exercise we also strengthen rotator cuff muscles, we have stability demands etc. So, one important technical detail here: when you pull back, your elbow joint should not pass vertical torso line, should not pass too much back, because especially under high load, if we pass too much torso, we can damage front shoulder structures, those ligaments and soft tissue, and also we are tilting the scapula forward during too much of shoulder extension in this way. Okay, the second and third exercise will be progression. So the second exercise is from laying position, supine position, typical plate press. This is scapular movement, scapular protraction is very important here. Activation of serratus anterior muscle. The next progression, a little bit harder exercise. We are pressing off the floor. We are basically reaching with the knees off the floor. This looks easy, but it's not easy exercise, especially for beginners. Our cat-camel exercise with knees off the floor. So the main goal here is to protract scapula, to exhale when we go up, and to let the scapula move smoothly around, to stick to the rib cage and move smoothly around the rib cage. One technical detail here I didn't do while recording is I prefer a little bit these arms a little bit more forward in front of the shoulder, because in that case we don't have only scapular protraction, we have a little bit of scapular upward rotation, which is perfect for, especially for overhead athletes from the health and performance standpoint, first and foremost. Okay, now we'll start talking about horizontal pull movements. Works on rear delts, triceps, biceps, scapular retractors, mid-traps, ROMs, etc. Better option for most injuries because upper back muscles are usually weaker. Okay, first exercise we'll show is a typical horizontal pull exercise, single arm cable pull. This is a basic and very important exercise in the beginning. It doesn't require much time to learn. It's very natural. One technical detail here, excuse me. As a previous example, so your elbow joint shouldn't pass vertical torso line, because especially under high load, as I mentioned before, and high speed, we can damage a little bit, make micro traumas of the front soft tissue, front shoulders soft tissue, and make one mechanical fault of the scapula called anterior scapular tilt, and we are making very bad habits and bad transfer long term when it comes to sports performance, etc. Okay, when it comes to second exercise, this is typical face pull exercise, one of the basic exercises. It requires very little time to learn as well. Very powerful, with huge potential exercise. One of my favorites. You have a external shoulder rotation moment. Here you should pull all the way up, approximately ear level. It should be your fist. One important detail also is that you need to hold a little bit here, maybe 1 second, as I show here, to make additional tension on your muscles. It's a very useful tip. And I forgot to mention, with all this exercise, whether it's horizontal, vertical, push, pull, you need to squeeze your butt and brace your core, make basically a neutral position of your spine, and you should be moving, which means that you should be basically moving only your limbs, in this case arms. Okay, now we will start talking about vertical push. works on delts, traps, upper pecs, triceps, traps, serratus anterior. Very useful for throwing movements, overhead athletes, but pain and bad posture can be limiting factors. This is very important to remember. Unilateral moves are better in order to include stability. First exercise I will show here is a simple barbell overhead press. This one doesn't require much stability because we are not doing a single arm option. This is basic exercise. The very important technical detail here is you can push one leg, place one leg forward in order to increase stability. Because if you make a parallel, you can fall forward or more often backward. It can be very dangerous, especially under high load. We have to brace basically core muscles over here and butt musculature in order to make a relatively neutral spine position and make the entire exercise more stable and safe. One more technical detail: when you move barbell overhead, you should, in this position over here, you should move a little bit head backwards in order to let the barbell pass your face, and then you should move your head forward while you pressing fully overhead with fully extended elbows. Okay, the next one requires a little bit more stability because it's a single arm option. This is the basic single arm dumbbell vertical press exercise. Very important detail here, technical detail as well. Forearm should be vertical or almost vertical when you in the descending phase, and you should move all the way up a slower eccentric phase. And when it comes to concentric phase, you should move all the way up fully overhead with fully extended elbows. It's very important to exhale up, inhale down, exhale up, and move a little bit faster up than down. Down movement should be a little bit slow. The third exercise should be actually first exercise. I showed these two first because they're basic, especially with injured athletes and athletes that are in the first or second rehab phase, or clients. They should be relearning movement pattern first. If they don't feel any pain during this fully overhead position. Of course, this position doesn't need to be fully overhead. You can also reduce range of motion if clients feel pain. So this is relearning pattern over here. You should move your butt a little bit back toward heels to fully extend basically from the downside the latissimus muscle, and which is make a little bit harder moving or rolling the roller overhead. This works from that standpoint a lot flexibility as well, or basically overhead shoulder mobility. As I said, it's very important to relearn this pattern because this is basic overhead movement pattern, which asks you to basically have proper upward rotation of the scapula, protraction a little bit, and activation of serratus anterior muscle, which is one of the main goals when it comes to giving this exercise. Okay, now we will start talking about vertical push exercises. So this is a basic exercise. You can also give during the first rehab phase a little bit higher demands than the previous. You're activating basically your serratus anterior muscle. When it comes to, I'm talking about the upward scapular rotation in a very specific way. This technical detail leaning, when I'm ending the movement, as you can notice here, I'm leaning a little bit forward in order to fully overhead, fully place my arm overhead. And of course, if you feel any kind of shoulder discomfort or pain, you should definitely reduce range of motion or change exercise. Over here we have a very similar exercise now with roller against the wall, and now both arms doing overhead motion. This is a little bit more specific for athletes that have these kind of demands, as for example volleyball players when they're jumping to block. Over here we have the next progression. So this one requires a little bit more strength, stability, and control in shoulder joint, because we have a mini band wrapped around wrists. One technical detail here I didn't show, but it's very important. You cannot notice from this angle, but before, in this position, starting position, before we are moving arms overhead, you should protract scapulas a little bit. So do like a little bit reach, which means round. So reach, round, and move slowly overhead with the full exhalation. So this is these three things are very important when it comes to proper shoulder movement overhead, or a long story short, proper scapular mechanics. We have more examples here when it comes to vertical push. This one is one of the most useful exercises, particularly for athletes that are injured and they cannot fully move arms fully overhead because of shoulder discomfort or pain to some degree. When you press, you're not moving fully overhead, but press forward, and you can load the barbell here. In the half kneeling position, you are making pretty much neutral spine position with bracing core and squeezing butt, like rear legs butt. Let's take a look again. This can be one of the first progressions when it comes to second or maybe third phase, rehab phase, and similar. Next progression, of course, is with the small hack. Once you stop feeling any kind of discomfort and pain, you can lean towards the forward at the end of the range, at the end of motion, in order to activate the serratus anterior more and basically move arm fully overhead, which is the main goal at the end of any rehab phase or before start implementing some sport-specific drills. Okay, one of the most useful exercise when it comes to vertical push. I intentionally mentioned this one the last. Best lower trap exercise, actually. The main role of the lower trap is to upwardly rotate and posteriorly tilt the scapula. So that's why this exercise is one of the most important. You're laying in a prone position, very relaxed, and massage table. You should hold a little bit up, thumbs up. You should hold the end range a little bit in order to activate muscle, to hold tension, activate muscle a little bit more. As we mentioned before, there's a lot of issues when it comes to anterior scapular tilt, and this is one of the best exercises. Studies shown very good EMG activation of the lower trap musculature. One of the best when it comes to these exercises. When it comes to this vertical pull exercises, Works on rear delts, pec minor, lower traps, triceps, biceps, lats, etc. Very useful for increasing range of motion, slow eccentrics, very important part. But pain can be a limiting factor. Here we can see the first one, very basic exercise, lat pull cable, like lat pull down. Why I mention slow eccentric? Because studies have shown that along with soft tissue mobility, soft tissue rolling, or some self-myofascial release, something we will show a little bit later, in combination with slow eccentric vertical pull exercises, can increase mobility. Very good, much better than actually static flexibility exercises or mobility exercises, active mobility exercise alone. Very useful exercise for activation of shoulder musculature, especially back shoulder and lats. When it comes to next exercise, we don't have any arm movement, only scapular moves, scapular depression movement. Very good example here to feel that scaps again, to return that kind of feeling before any vertical pull movement. Okay, mixing some basic movement patterns. We can make some mixes. For example, over here, very useful exercise from laying supine position with bended knees. We're mixing vertical horizontal push with eccentric vertical press. Over here, very important and very useful exercise when it comes to increasing range of motion. Over here, as we mentioned before. Over here, we mentioned something similar before, cat camel exercise, but now with this vertical movement over here. It's like vertical push. So we are activating serratus anterior muscle a little bit more. So we have scapular protraction with upward rotation. Have more examples here. Okay, this is basically next progression. Not easy exercise at all from the motor control standpoint. We have horizontal push over here, vertical push, something like a downward dog position, downward dog yoga movement. Over here we have horizontal pull with external shoulder rotation over here, and vertical press, very useful shoulder rehab exercise. We have multi-planar movement. Of course, this is not in almost any injury, not first rehab phase, but maybe second or third, where when a patient doesn't feel any pain in shoulder. Over here we have one more combination. You can play the way you want, as long as it's a safe movement and the patient doesn't feel any discomfort. Okay, now we are going to explain what functional range conditioning is. So the FRC, or functional range conditioning, is a system of joint health and mobility training. The functional range conditioning system of training applies scientific methods to expanding active, usable range of motion. So this is something relatively new, invented by Andrea Spina, very good movement specialist. Mobility is the ability to control range of motion. So this is very important to differ mobility from flexibility. So this is ability to control range of motion. Mobility in a functional range conditioning sense is defined as strength plus control. So very important and very smart philosophy in order to improve joint health. So strength plus control in order to expand upon usable range of motion, articular resilience, and overall joint health and longevity. So over here we have very simple basic exercise. This is controlled articular rotations. So by moving, it's important to mention by moving with all the ranges over here. So if you notice, there is internal, external rotation of the shoulder, full range of motion, overhead, trying not to move your torso or body in general, everything should be static, but shoulder joint. And it's important to mention that by moving slowly, there is very positive influence on tendons, ligaments, and articulage and lubrication and everything joint related. So this is one of the so slow motion and under tension, pretty high tension. This is body weight exercise, but if you never tried, please give it a try, because this is very, very tough, even though it doesn't look so. Moving slow, very, very, very useful for tendon and all other structures around joint health, first and foremost. Over here we have the next, basically you can call the next progression. Basically the same principle, the same outcomes, the same philosophy, but just laying the prone position and vertical placed bench. So movement should be very slow, under tension non-stop, as I mentioned, not easy at all. Okay, we have over here for some people next progression, for some not, but this is basically the basic lift off exercise. So you're moving from thumb up from overhead position or overhead, or maybe like Y letter, a little bit aside. You place a roller or some other object in front and lift off, hold a little bit, and trying not to touch object, you're passing your arm all the way to the other side and back. This is a very similar example, but now you place a roller on the elbow joint, and we have external rotation movement here. Of course, always hold a little bit position in end range, which is very useful for injury prevention and rehab as well. Because in most sports, and when it comes to very high percent of injuries, especially non-contact injuries, we are getting injured basically in the end ranges, whether it's in soccer, some kind of slipping, like splitting, trying to reach ball, or trying to stop opponent, or a similar situation. We can injure groins or hamstrings or any other muscle group, and variations like this one can pretty much prevent that, or at least this is not fully, of course, specific movement, but at least it can make all the structures around joint soft tissue more resilient, more strong, and at least reduce or improve or speed up the rehab process if eventually end up with injuries in some during some sport specific movement. Okay, let's talk about basic dynamic flexibility. So don't forget to roll the major muscles. This is the first and the most important thing. Let's move back a little bit. In order to relax musculature a little bit, to reduce tone, coming from the brain to the muscle, which can short-term increase flexibility. And always this should be accompanied, followed actually by some either eccentric movement, like slow eccentric movement, full range of motion, or something similar, in order to keep that gained range of motion done by rolling muscle itself. Thoracic spine mobility can be often an issue. So this is very important, and not many people pay attention to it. So always pay attention to thoracic spine. If it's a kyphotic, it's a very often situation where you cannot fully make a full overhead movement just because of a kyphotic position of your thoracic spine. So the shoulder blades are at the mercy of the thoracic spine. If that doesn't move, then it will be hard for the scapula to move as well. So we have a couple of examples here of rolling pecs. Very important for overhead movement or external rotation of the shoulder, because pecs are primarily internal shoulder rotators. We have an example of self-myofascial release with simple tennis ball lats here. Also very important for full range of motion when it comes to overhead moves, at least, as well as external shoulder rotation. Over here we have very useful exercise, doesn't require any equipment. Thoracic spine mobility exercise. You can hold a little bit back position over here. Very useful exercise, and after a while it will give you better thoracic spine mobility. And over here, another very useful one. So this is even more useful in my opinion, because as you can see, he's holding a little bit up in end range position, because he's trying to make this already useful exercise even more useful, because this is actually active, holding active range of motion, or making active range of motion, which means including muscle in your mobility improvements, which is very important from the injury prevention, at least. Okay, there's some more examples here. We already showed this one before, but that exercise can be placed actually in this part, basic dynamic flexibility. Actually, we have here external rotation of the shoulder and internal rotation of shoulder. You should pay attention here not to anteriorly tilt too much. Not to anteriorly tilt the scapula too much here during shoulder internal rotation. So your scapula should be pretty much stick to the floor, not trying to move around non-stop, especially when it comes to anterior tilting. External and internal rotation. So this kind of movement when it comes to shoulder joint are not that important from the functional standpoint, but they are important when it comes to strengthening individual muscle groups, especially those muscle groups that are usually weak external shoulder rotators, like small rotators, or better said, small shoulder stabilizers, like supraspinatus, infraspinatus, teres minor, and other muscles, subscapularis. So the main goal is to activate rotator cuff muscles, supraspinatus, so isolated strength, supraspinatus, infraspinatus, teres minor, subscapularis, in an isolated manner. So weakness and atrophy of the infraspinatus, studies show, results in higher EMG activity of the deltoid and trap muscles, and lower EMG activity of the serratus during shoulder elevation. So, among other things, this is exactly why external rotator cuff muscles, or rear rotator cuff muscles, supraspinatus, infraspinatus, particularly infraspinatus, we should be strengthening, whether in isolated, more in during compound moves, for example, hanging or bear crawling or similar. This is the main reason, because as we saw here, it's extremely important to have that muscle strong enough in order to prevent the deltoid muscle from over-strengthening the system and over-dominating. And when deltoid is dominated muscle, especially during overhead motion, it can pull all the system or humeral head up and translate humeral head up during overhead motion and impinge supraspinatus tendon or some other biceps tendon, long head, etc. And as we mentioned, the lower EMG, it shows lower EMG activity of the serratus during shoulder elevation. So this little muscle, infraspinatus, if it's weak, can make a lot of mess in the shoulder joint and surrounding structures. So we have here one of the best exercises, and I'm pretty sure that the EMG studies shown that this one have pretty much the highest EMG activation of the infraspinatus muscle, particularly with this small hack over here, placing a fist or a rolled towel between torso and elbow, which can increase stability and of the system, and then isolate infraspinatus muscle even better, and consequently make better activation. Or here there is a study showing pretty high activation of the infraspinatus or the rear rotator cuff muscles. So it's a typical standing external rotation, either cable or rubber band. So very useful exercise you can always do at the end of the session, as it can be pretty much the last exercise. It doesn't require much motor control. It's single leg joint, very activation of very small muscle group, so recovery is pretty quick. Okay, over here we have first exercise, typical internal rotation for subscapularis muscle. That muscle is pretty much underrated, very important for preventing any translation of the humeral head during powerful motions, during throwing motion, similar. Or here we have isolated external rotation during isometric first, bilateral steps, doing lateral steps, and then placing arm overhead and holding 90 degrees in elbow consistently. By doing that, we are changing angle a little bit, so it's very useful to change, not to do the same angles non-stop from the shoulder joint health and joint health in general, and injury prevention standpoint, as well as rehab. Okay, let's talk about perturbation stability drills here. So this is pretty much next level, maybe third phase out of 4 or 5 of rehab. So the main goal is to activate rotator cuff muscles in more functional. When I say more functional, I mean more specific and functional, because during sporting movements there is no external internal rotation. There is basically, but everything works together during external and internal rotation, or moving the entire system. Your system, shoulder system, don't need, it's not required only to do external internal rotation, it needs to stabilize the entire system and keep during those external internal rotation and similar, and keep basically the shoulder joint, the ball centered in the socket. That's actually the main goal of all the smaller stabilizers of the shoulder joint. So over here we have a perfect movements exactly in order to reach that kind of goal for sport specific moves. We can start with simple exercises like this one, kettlebell bottom up, shoulder carry, waiter's carry variation. So you have a stabilization requirements over here when it comes to shoulder joint by shoulder stabilizers, as well as wrist stabilizers. Everything, basically the entire system works here with this simple exercise. Next one a little bit more complicated, next level, next progression. So making changing angle, as we mentioned before. You can basically play with this exercise, different angles, different options. This one is not only battle roping, is not only condition exercise. During those moves, you're actually working very hard on stabilizing shoulder motion, shoulder joint activation of those rotator cuff muscles, at least in a stabilized position. In this case, in the half kneeling position, where we work only on not only in shoulder stabilizers, but core musculature as well by squeezing butt, bracing core. The entire system tends to be destabilized, and all these muscles works together in order to hold it stable and safe. Over here we have exercises that looks pretty simple, but it's not. But this is the lowest progression, of course, when it comes to this type of exercises. We have pretty much good activation of rotator cuff muscles over here, while doing all the angles from arms directed vertical in front of hands in front of shoulder, all the way up overhead. Very useful one. And over here we have the next progression. This one particularly looks easy, but it's not at all, because if you never try, give it a try, and it's not easy to move and control roller all the way overhead or almost overhead and back to the starting position. Your muscles, especially rotator cuff muscles, are working hard to stabilize the movement and not falling forward on your nose. And perturbation stability next level. This can be very useful exercise like half Turkish get up or similar. We have from actually from being from arm in front of shoulder, in front of chest, moving all the way up overhead, activation of core musculature as well. So killing two birds with one stone. Over here we have a rotational component working on thoracic spine mobility as well. Killing two birds with one stone as well. Arm bar, one of the most important exercises for shoulder health and rehab and injury prevention. You're basically changing angle here, and your muscles are working hard to stabilize in different angles, especially over here. When your arm is behind the torso over here, which is very often situation in sports, especially when you're throwing baseball or similar, when you're swinging arm backwards, preparing for explosive movement. So in that position, your entire system, the shoulder joints and the surroundings needs to be very stable, and that's what you exactly train while doing this exercise. Okay, over here we have some medicine ball variations. You lean forward, translate weight a little bit to our medicine ball, and trying to stabilize by using shoulder musculature, especially those stabilizers. Over here we have a variation with mini bend, changing angles. Very useful one, so your musculature can feel each movement, each position, each angle, and make it resilient and basically injury-free. Over here we have one simple exercise that requires a little bit more hand strength. So we have single arm option, but you start with both arms hanging and from hand to hand a little bit, and then if you don't feel any discomfort and pain, because this movement hanging actually can be very you can feel pretty much discomfort if you have any kind of injury in your shoulder, particularly your soft tissue, ligaments or tendons, because you are hanging on them. Basically, you're not using muscles but hanging on ligaments, tendons. But very useful one for strengthening, functional strengthening of your rotator cuff muscles. Okay, we have here not that easy variation, so this is basically next progression, one of the hardest progressions. Basically what happens here is then we are trying to stabilize movement from basically push-up position under unstable surface, and trying to activate serratus anterior during all the way up, pushing back and moving arms overhead. So activation of serratus while simultaneously your shoulder joint is trying to stabilize movement by including rotator cuff as well. So pretty much all the musculature included in killing few birds with one stone. One of the most useful exercises for sure. Over here, next progression, pretty much difficult one. Not only, as I mentioned before, not only shoulder musculature work here, so you have pretty much everything works, but particularly core musculature included. Bouncing, trying to stabilize, it's not easy at all. And the hardest one for sure, single arm. It's pretty much easy to fall over your nose because it's not easy. This is probably the hardest variation I tried. It's not easy to stabilize the system by placing only one arm on the ball. Okay, over here we have a lot of med ball variations. This is basically typical playing, trying to make training a little bit more, or treatment a little bit more interesting. You have hundreds of variations, literally. I will show some of them. Very useful for activation of shoulder musculature, particularly rotator cuff. You can use this as a progression as well. Okay, we have now perturbation stability sport specific. So we are doing switching to a little bit more sport specific movements as we are going forward when it comes to our rehab. Over here you have a typical eccentric movement, so slowing down of the barbell from a half kneeling landmine position. So as you saw here, there is a first variation in bending elbow and moving forward when it comes to concentric concentric phase a little bit easier, and overhead we have both concentric and eccentric phases pretty much hard. So this is I forgot to say very specific throwing movement when it comes to, particularly when it comes to the eccentric phase. Over here we have a very useful one from a bend over position, trying to catch a ball or dumbbell or anything. Don't try to catch anything too heavy because we're messing coordination and motor control a little bit. It can be risky from the injury standpoint, re-injury standpoint. So we're changing angles in the shoulder joint, in the elbow joint, and we are stopping movement here when we catch the ball or dumbbell. We're stopping moving, trying to engage rotator cuff muscles and all the muscles that actually stop that movement, stop throwing movement, reduce that speed when we are finishing throwing movement. And those muscles are external rotation and small stabilizers as well. Over here, pretty much specific movement, as well as the next, it can be next progression, because not from the difficulty standpoint, but from the specific sport specific standpoint. So we are starting with smaller weights, so for example tennis ball, and then smaller weight medicine balls, and a little bit heavier. By doing this exercise, we are actually, what we train, actually we are training a stopping movement, engaging those external rotators, shoulder rotators eccentrically. Okay, there is one more example, very useful example, by using a partner, a coach, changing angles over here. So this is a thrower, baseball player. So during all the phases of the throwing motion, we need to keep our shoulder stabilized, and we should train that way, so our shoulders don't get confused when it comes to sport specific movement, and increase resiliency tremendously. Or here I wasn't allowed in this gym to go a little bit more backward, to make more explosive movements, and but you can see the idea here, changing angles as well. So this is even more sport specific throwing movement. You can of course increase distance. Okay, programming strategies. When it comes to programming strategies, I will leave you just read the messages here. The most important things, basically you can do almost whatever you want as long as you follow some very simple rules, from easier to more complex, simple, more complex, easier, harder. Actually, always start with easier variations, and via progressive overload principle move toward more difficult bars, all the way up to the sport-specific movements, and finally going back on court to play your favorite sport or enjoy life again. You always start with warm-up. This can be also different minutes length. Never do foam rolling for more than maybe 10 minutes max, because everything above is a waste of time, because foam rolling have their specific goals. It's not training itself. Start with some basic dynamic drills, basic dynamic flexibility drills, or if you don't like it, it's not necessary to do. Finish warming up with 3 to 5 minutes. Functional range conditioning. The main part. And the final part, always, it can be something a little bit more complex, or more often a very simple single joint exercise where you're basically strengthening one muscle on one muscle group that is not big, not multi-joint, and that's something actually you can recover pretty easy from. And your training could also consist of, very important principle over here, can be something else, but simple. It depends always on your type of injury. And summing up, the 3 most common shoulder injuries: slap tear, shoulder instability, rotator cuff injury. Return to sport depends on many factors. One size doesn't fit all. This is probably the most important message when it comes to this lesson. The most useful types of shoulder healing movements we were already talking about, just to remind you. Programming strategies, don't forget that you can mix almost anything with everything, which of course depends on the specific case. And probably the most important message here, I intentionally saved at the end of the presentation. Remember, results of every aggressive one-size-fits-all rehab program in history: 25% improve, 25% get worse, 25% stay the same, and 25% get injured somewhere else. This is a brief reminder why individualized assessment, rehab, and training are the keys. Thank you so much for listening to this presentation. Visit my website for more info, for more webinars, text articles, discussion, www.microtraining.co.